move over. Stay right here. Okay. We get confirmation. All good? Start over. All right. So we're going to talk about tips for staying warm and alive in the backcountry. Makes sense. Excellent. All right, we're back. Okay, so we're going to talk about some cold-related injuries. This includes hypothermia, frostnip, frostbite. Starting with who is affected most by the cold, the outdoor enthusiasts. This is just because we're out there for longer and we've got extended exposures, possibly poor conditions, depending on what we're doing. The alcohol intoxicated are more affected by cold, and this is because of the vasodilatation. So all of your blood vessels dilate, and so that loses heat faster, basically. And then the extremes of age, so both your infants, kiddos, and then really old folks, because they just have poor thermoregulation. They can't control their temperature as well. A quick reminder on how we lose heat. So conduction, radiation, convection, and then evaporation. So conduction is basically your contact with the ground. So it depends on how much body surface area is in contact. This is essentially why we sleep on pads, right? When we're camping, it's to try to decrease conductive heat loss. Radiation, this is the difference between your body temperature and the air temperature. This is why most of the time we want to keep the rooms at about 68 degrees. And so the further that differential, the more you're gonna lose heat by radiation. So if it's 0 degrees out, you're gonna lose more heat than if it's 40 degrees out, right? Convection, this is the currents in the air. So in our case, it's wind usually. So obviously the more wind you have, the more heat you're gonna lose. And then evaporation is what happens with sweating or with wet clothing. So this is the process, or this is why we like the trend of the fans with the misters that is always at the markets. It's because it's using evaporative heat loss. So what's the best place to shelter? Knowing that, we want to have limited contact with the snow or the ground to prevent conductive heat loss. We want to be insulated to protect from radiant heat loss. Bonus points if you've got a fire. We want to be out of the wind so that we're not losing by convection, and have dry clothing on so that we're not losing by evaporative heat loss. So what happens when you're cold? Your body tries to create heat in your muscles by shivering. So it does these like micro twitches, right? And that creates heat. Your superficial and your peripheral blood vessels constrict in order to shunt your blood to the core and the brain. So that's why we get colder in our hands and our feet, because everything's trying to move centrally. Okay, so here's the big money right here. So the stages of hypothermia. So normal obviously is 98.6 degrees. You're moving normally, you've got normal consciousness. You may or may not be shivering depending on how you run. And then you've got normal cardiac output, so normal heart function. By the time we get down to about 95 degrees, the first thing that we'll notice with mild hypothermia is impaired movement, okay? And so what this might look like is, oh man, I just tripped, or I can't do a kick turn like I'm supposed to, or you're just kind of stumbling a little bit, kind of subtle. And then as you get colder, what happens is then it starts to affect your consciousness or your alertness. So you start getting more irritable, you start getting confused, you maybe start stumbling over your words. Then as we get even colder, the shivering function starts to get lost. We are unable to shiver when we get down below about 90 degrees. Then worst case scenario, we start getting into the moderate hypothermia. and we start to see impaired cardiac output. So our heart starts to not function as well. It's also at that point that we stop shivering altogether, okay? So if you're getting to moderate hypothermia, you've already fucked up, okay? And then obviously if you're getting even colder into the severe hypothermia, you have the possibility of going into a coma, and you have a possibility of going into cardiac arrest, a dysrhythmia. The heart muscle becomes unstable, and so any little jostle can just set off a ventricular arrhythmia. So the important thing here is that not necessarily the temperature. It's because we're not going to be in the backcountry with a probe, or that we're not going to be measuring it necessarily. It's about what are we seeing, what are we noticing in our friends, right? So if you start to notice like, oh, they're usually a really good skier, and all of a sudden they can't make their turns, take note, okay? If you're like, oh, they're usually really cool, and they're kind of being an asshole right now, maybe it's because they're cold. If they were shivering and have stopped shivering, that's a bad sign, okay? So it's a spectrum. We want to stop it at the earlier points. So realistically, I want you guys to know that if you're starting to stumble and you're starting to get confused or feel not all there, then you need to stop and start rewarming yourself, okay? Questions? Okay, so life-saving tip number one, if you go away with nothing else, moderate and severe hypothermia is a medical emergency. And so if your friend is experiencing hypothermia of that degree, they need to be kept flat. You need to handle them gently so that you don't send them into cardiac arrest. Solid? Solid. Okay. And then depending on where you are, you're going to call 911 or search and rescue if you're in the front or backcountry. So what do we do in the mild stages? Going back to kind of the ways that we lose heat, we want to insulate. So we want to remove any wet clothes. We want to pile on any kind of insulation. If it's sleeping bags, if it's coats, if it's blankets, literally whatever you've got, pile it on, get them warm. And then you want to put a vapor barrier on, so something that's going to keep the heat inside. So I always recommend, keeping a contractor bag. So like straight up from Lowe's or Home Depot or whatever, you're gonna literally get inside of this if you're experiencing hypothermia, okay? So you like keep this in the bottom of your pack at all times because it might save your life sometime if you're stuck up on a mountain. Cool? Those silver thermal mylar blankets, they're shit, never buy them. They just rip and then they're useless, okay? That's way better. Next thing that you're gonna do, you're gonna replete your energy because it takes energy in order to shiver and in order to stay warm. So you want low glycemic index foods. This is like everything that the doctor usually says don't eat, okay? Gummy bears. Gummy bears, cookies, peanut butter, anything that is calorically dense. Like those oatmeal cream pies, love it. That's what you want when you're hypothermic. And then you also want external heat. So whether you're sitting by a fire or the other trick is if you are able, depending on where you are, boil some water, put it into Nalgene's, stick it in your groin and your armpits. It's gonna keep you real warm. It's also a good trick just for camping. Chemical hand warmers are not gonna be enough to warm the core, but can't hurt on the hands. You don't, however, want to use a hot tub or a warm shower because what happens is the risk of afterdrop is higher. So afterdrop is basically when all of that cold blood from the periphery gets warmed so quickly and then it comes back, or all the cold blood goes back to the heart, and you can increase your risk of cardiac dysrhythmias again. So don't use hot tubs. Moving on to frostnip and frostbite. This is another spectrum type of disease. So it's when any skin is exposed to below freezing temperature, it causes local damage. And the severity of this depends on how deep it goes into the skin. So it's usually your fingers, your toes, your nose, but it really can be anywhere. And the part that's most painful is actually the rewarming. It's when the blood is going back into that area. And you don't want to rewarm until you can guarantee that that person is going to stay warm. So you don't want them to get re-exposed to the cold. So if that means delaying warmth for another half hour until you can get to definitive care, that's what you want to do. But as with most things in medicine and in life, it's better to prevent this than to treat it. So basically frostnip, it's just very superficial. It's a local color change. You get red or purple. It can be a little bit sore, but there's no lasting damage. Then when you move into the superficial frostbite, you might get some like pins and needle sensation. It might turn white or yellow. That's when you're actually getting crystals into the skin, ice crystals. And then going deeper into the skin, you can have deep frostbite. That's when it's numb and it starts to necrose. You won't see those things until afterwards, though. So you can't really diagnose it in the wilderness. Okay, so how are we going to prevent all of these things from happening? We're going to layer. I'm sure everybody here knows how to layer. I'm not going to act like I'm the expert in that, but some main points that I want to make is that you always kind of want to use a 3-layer system. So thinking about your base, your mid, and your top. Base should always be synthetic. We're not using cotton, even for our underwear. Like you want a synthetic underwear. You want it moisture wicking, especially for our females. You want to, when you get back from your adventure, get clean, dry, and free to prevent UTIs. Basically, it's saying that you want to free ball it. Then on the top, you want something synthetic or merino wool, ski sacks. Then the mid is going to depend on all of the conditions and the activities. Maybe you want a neck buff, maybe you want thin gloves, thick gloves. All of this is very like modular. Then your top is your shell. It's a balance of both the waterproofing versus breathability. So generally speaking, the more waterproof something is, the less breathable. The more breathable, the less waterproof. And so you're trying to find where is the best fit for what you're doing. So like when I'm touring, I will not wear a shell on the uphill, but I'll put it on for the downhill. And then just a quick plug for we should all always wear our beacons and our shovels and our probes, right? Okay. Altitude illnesses. So this is acute mountain sickness, haste, and HAPE. So at higher altitude, what happens is that the partial pressure of oxygen decreases logarithmically. So what you get is a low pressure decrease in oxygen. And so in order to keep enough pressure to get oxygen through the body, we compensate by breathing faster, okay? The normal respiratory rate or breathing rate is about 20 per minute. Mount Everest, they're breathing 50 to 60 breaths per minute. So it's just crazy. And then that hyperventilation causes carbon dioxide to come out. But the carbon dioxide is also what determines our drive to breathe. Like our body figures out how often to breathe by how much carbon dioxide is available. And so by us getting rid of that, we are decreasing our respiratory drive. And so then our kidneys try to compensate by excreting bicarbonate to maintain the pH balance. Basically, we pee more. This is why you need more water when you're high at altitude. Okay. Risk factors for altitude illness. If you've had it before, if you're going up really quickly, or if you're going up really high. The common misconception with altitude illness is that, oh, I'm fit, and so it's not going to affect me. I'm young, it's not going to affect me. That's not true. So fitness level, gender, age are all not risk factors for altitude illness. So what are the symptoms of altitude illness? For acute mountain sickness, it's somebody who has recently ascended above 2,500 meters. They've got a headache, and then they've got one other symptom. And this can be very vague. It's dizziness, lightheadedness, just tiredness, feeling weak, feeling nauseous, feeling like you just don't want to eat as much. That can all be acute mountain sickness. Then, as we've seen, a spectrum. So it starts with acute mountain sickness, and then it tends to get worse. So HACE is the next worst thing. So high altitude cerebral edema. This is swelling in the brain. Okay. So you get the acute mountain sickness, plus then you start stumbling. You start getting more confused. You might be more irritable. And this is usually within a day or 3 of going up. Okay. Then the other version of HACE is HAPE, which is swelling in the lungs instead. Again, it can be very subtle, actually. Like, it might just be, man, I usually could have done this. I'm fit enough to do this, but I just can't today. I'm too short of breath. I'm coughing. I'm weak. I might just not be able to keep up with Brad Schaff anymore. I don't know. And maybe it's because there's swelling in the lungs. So again, you can see it's a spectrum that we want to catch it at the lower elevations, when we just have a headache and we just have a little bit of irritability, maybe some dizziness. We do not want to get to the HACE and the HAPE, right? So for reference, Snow Basin at the peak is 2,800 meters. So it is possible for people to get acute mountain sickness at Basin. Especially if you're coming from out of town. Like if you live at sea level and you fly in, you immediately go skiing the next day, you could have acute mountain sickness. So life-saving tip number 2, the treatment of altitude illness is to descend. It's to walk downhill, period. Okay. Mild cases, they're going to resolve within a couple of hours. You're going to feel better just by getting down in elevation. But people who delay their descent can actually die from this. And so if you take nothing else away, you're at high altitude and you feel like shit, go downhill. Solid? Okay. The way that we prevent this, there's a couple of ways that we prevent it. We should be doing acclimatizing by going up to one level, staying there for a couple of nights, then going up no more than 500 meters, stay there for a night or 2, and then keep going up. There's also medicines. Talk to your doctor about it. I want to just leave it at that. Okay, last thing. How do I pack a medical kit as a layperson? It's a lot of, it depends. So how long is the trip? How many people are going to be there? Are you the only one bringing a medical kit, or are multiple people bringing a kit? What activities are you doing? How far are you going to be away from a hospital? Is your friend a diabetic? Is your friend have high blood pressure? Are there medicines that you need to make sure to bring? Are they asthmatic that you need to bring albuterol? So in general, we use this pause mnemonic. So you want to make sure that you're covering prevention, procedures, analgesics, meaning like pain management, any antibiotics or antiseptics, so ways to clean your wounds as well as take care of the pain. Wound care, meaning like ways of dressing a wound, and then anything that you need for survival. So some general things that I tend to bring. This is not a complete list by any means, but things that I at least think about. Bringing gloves for personal protective equipment, some bacitracin or Vaseline. This is like the go-to for keeping a wound nice and moist, because a moist wound will heal faster. Telfa, that's basically the inside of a Band-Aid, same material. Tape that down. Steri strips are great if you've got a small cut. A syringe for cleansing wounds. So I don't know if you've ever tried to just like wash out a wound in the sink. It's a lot harder than if you have some pressure behind it, right? So if you bring like a 20 milliliter syringe, you can use it to pressurize and clean the wound easier and faster. SAM splints, does everybody know what a SAM splint is? Yeah? Okay. No? I brought anything that you would be willing to drink is fine to clean a wound with. Depends on who you are, yeah. Okay, so this is a SAM splint. And it is basically a piece of metal, flexible metal, covered in some foam that you can mold. Okay, and so if you were to fall and break your arm, for example, then you might do something like this, where you fold it in half and you put a little curve in it. And maybe you give yourself a little handle down here. And then you get this guy. Little ace wrap. And so if I broke my left arm, I might go like this and wrap it around to secure my SAM splint in place until I can get into more definitive care. Because anytime, if it's a broken bone and you stabilize it, it's going to be more comfortable. And even if you don't know it's broken or not, maybe it's just sprained, it's probably going to be more comfortable if you just stabilize it. So there's your splint. Okay. Next thing that I will bring is KT tape. Does everybody know what KT tape is? Yeah? Okay. So it's just fancy tape that helps to support things. So like people with bad knees, there's lots of fun ways to design it to support your knee. Fun fact, you can use it for pregnant bellies when you're skiing. You might also bring water and a purification system depending on where you're going. Some kind of blister prevention. I personally like moleskin. And with blisters, if you get one and it's small, leave it alone. Put moleskin in a circle around it to offset. If it is large and in charge, you want to put the tiniest little hole in it, okay? Just so that it can drain, but you want to leave that skin in place. Okay? Maybe you consider fire starter, maybe you have a knife in your kit, maybe some basic meds, so ibuprofen, Tylenol, Zyrtec, albuterol. Go see your doc if you need more prescriptions. Maybe you need sunscreen, depending on where you're going, and then that contractor bag like we talked about. Okay. That's all my fun facts. Woo-hoo. Questions? Yeah. It's the name of a guy. I think it wasn't it. I was gonna say it was invented in Utah. Yeah. Yeah.